So we want to jump right in. I want to welcome Susan Kirchhoff, and I'll let you briefly introduce yourself and set up our first topic.
Thank you, David. As David said, I think so much. I've been in healthcare for a really long time and spent most of my career as an administrator. And I can't tell you how many meetings I would sit in over the years where we would talk about what patients wanted. And we thought we knew. Because we were taking care of them after all. And so we thought we knew what was best for the patient, and we spent absolutely years figuring out ways to take better care of the patients. And guess what? Our satisfaction didn't improve. Our patient experience didn't improve. And one of the things we learned, finally, it took us years, what other types of businesses learned a long time ago, and that's that it's critically important to get the voice of the customer, not just in a written format, but in a live format. So we thought it would be most appropriate to start this session with the voice of the customer, sharing the experience and what makes a good experience for them. So I'm really pleased to introduce Margie Turner. Margie is the co-chair of Providence's Patient and Family Advisor Council. Okay, so Margie, we're going to pretend like we're on an interview show, and we'll ask Margie a couple of questions, and then at the end, if you want to ask her, if you're curious for her perspective, we have her live up here for as long as she's willing to do it. So we're going to start out, Margie. Can you tell us? Think back to the best experience you ever had with your provider. And we want you to tell us that story and then tell us what about it made it a great experience.
Well, I have a really great provider. So probably almost any time I go into the office to see her, it's a really good experience. The results aren't that great, as a lot of us know when we walk in and go, oh, she's going to put the cleats on and kick me, but that's okay. I think the best experience I had actually is more with my family. My experiences are great, but I have a very picky mother-in-law. And my husband first went to our provider based on a hospitalist recommending her. And when we went to her, we thought, oh, this is perfect for my mother-in-law, because my mother-in-law has a whole range of medical issues. This poor woman, she has a range of specialists. And when we went to this provider was excellent. She orchestrated my husband's care. Okay, you need to do this, you need to go here, you need to go here, we'll set this up for you. And my husband and I walked out, Dennis is his name, and we walked out and I said, this doctor is for your mother. And so we encouraged her and she went. And her best experiences, even though she is very grumpy about a lot of things, is actually when she goes in and the doctor cares for her in such a way that she feels like her needs are being met. Now, they may not be able to figure out what's wrong sometimes, which has been the case, but this doctor will go above and beyond to make sure that she's getting what she needs. In fact, she just recently had a very interesting transplant done for C. diff. And it was her doctor, along with the gastroenterologist, I think I said that right, who recommended that she do this because she's been suffering it for years and years and years. But to me, that's the best experience, is that when she doesn't come and tell me about how bad it was, but how good it is. And I have that same experience with the doctor right now. She anticipates what I need medically, and it helps me with my preventive care, which I don't always follow, I have to admit, but she does do that. And
So when you think, staying on that theme, when you think about your provider, and you think about a visit, what are the most important things to you in your relationship with your provider?
Well, the most important thing to me is that I can be open and honest with her and that she listens to me. I went to the same doctor for 20 years before I went to her. 20 years with the same doctor, had his own little shop. And I go in for a doctor's appointment and I go in for my annual physical, and we spend almost an hour together, and then he'd do my blood work, he'd do the orders, and then 6 months later we'd talk about that blood work that I did. And I thought, okay, there's something wrong here because I'm not feeling very good, but we're not addressing problems right here. And what I love about my doctor now is that she'll send me a reminder. It says, your lab orders are there. I need you to go get your lab work. You need to fast. You need to do this. And then you need to schedule an appointment right afterwards. And I get instant response back because I'm signed up to my chart, which gives me the next day I get my lab results. And I can also do my appointment online to her. So, yeah, the best thing about it is when the doctor is working with me as a patient and working with me to help with my health conditions.
So I'm going to take that a little step further and actually refer to some of the survey questions for those of you that may not know. The CGCAP survey asks some different things from a typical what we call patient satisfaction survey to get more at the experience. So some of the questions that get asked is, did my provider listen to me? So if you walked out of the office today and you felt listened to by your provider, what would that look like to you?
Well, I would walk out and go, wow, she answered those questions. Or if she didn't answer them, she put me on the track to answering them. So something that may seem insignificant to me during a conversation part with her will trigger something, and she'll say, okay, well, let's go do this and go do that. And she'll listen to what I have to say. I may negotiate with her a little bit, which I have, and doesn't always work because she's always right. But she's not here. I don't think she's here. So she didn't hear me say that. But yeah, it's when I walk out of the office and I go, okay, I don't have any other questions that I need to either email her about or call her about. And I know that she sat there and gave me her full attention. That's perfect.
And I'm just going to probe a little bit more so that we can get specific. How do you know she's giving you her full attention?
Well, she's looking at me when she's talking to me. She may be on the computer, but she's looking at me and I'm looking at my chart at the same time. She's giving me that one-on-one attention. A good example of what not to do, I guess, is I was thinking about this morning when I was driving in. I was trying to do the good and the bad in my head for this. And my other doctor, I always plan a 8 o'clock in the morning appointment. I want to get this done. I got to get to work. I don't want to take 2 hours out of my day. So I'll do it first thing in the morning. And I purposely make that early morning appointment. And my other doctor, one-man show, I'd come to his office at 8 o'clock. He'd see me. He'd say, I'll be with you in a few minutes. 5 minutes, classical music playing, trying to keep awake. 10 minutes after 8. And he's just tooling around. I mean, I can see him. 15 minutes. Appointment was at 8 o'clock. Oh, 8:20. Oh, I'm ready for you. To me, you're not caring about me. I mean, that was part of the catalyst for change for me in my life, for moving to a different physician. And what I like is when the MA comes in and she does her thing and then she leaves, she says, okay, the doctor's going to be in about 3 to 4 minutes or 5 minutes. And that's about the time it takes. And I have an expectation. I know it's going to be this amount of time. And I just, yeah, I mean, that's, the two sides of this is that I was very unsatisfied because you just took 20 minutes out of my time at the other place. Whereas here I have been given clear expectations. So hopefully I answered that.
Yeah. So one other question that I've noticed when we work with providers that's hard for them to understand what it looks like to a patient. So one is treated with respect. Respect me as a person, treat me with respect. So from your point of view, what does that look like? If you were going to say, oh, I'm always treated with respect, what would that be? What would that look like?
I think the big thing is that me as a patient, I don't understand a lot of those really big words that doctors use. You have to go get this. And it was, I'll use an example, a type of an ultrasound. And I said, okay, never had one of those. Can you describe it to me? Because I didn't want to just walk in blindly to a test. And so she described it to me. And I think that to me is respect in the sense that if I ask you back, what does this mean in my terms? And you come back and you say, this is exactly what they're going to do. They take this and they do this and they whatever. Try to think of another example. I work in accounting. I'm an accountant. And I had this situation this morning. I speak in a totally different language than anybody else in my office. Debits, credits, assets, liabilities, equity. And I was trying to explain what I thought was a very simple concept in my head to another employee. And I finally realized I had to back up and explain it a different way because they weren't getting it. And I think as patients, we have to ask our doctors, questions so that we understand. Just because the doctor says you need an A1C test, what is that? What do you mean? Why do I need this? And what I love is the doctor explains that back to me in a terms that I understand. Well, that's to test your long-term blood sugars, and it looks at your blood. Even though we take it today, it shows a 3-month pattern of what your blood sugars are at. So I have an understanding now what that means. So when she uses that term, I understand it.
Thank you. So we've been talking a lot about the provider, but now let's step up a level and think about your whole experience from the time you walk in the door at your clinic until you leave. So outside of your interaction with your provider, what are other things that are really important to you?
If my appointment's at 8 o'clock, I can understand going in at 8:05. You check in. The facility usually has you come in about 15 minutes early, which is great. I plan for that. I want the front desk people to be friendly. I have a great relationship with the clinic manager where I go. And so it's really funny whenever she sees my name on the schedule now, she goes out and has the waiting room all cleaned up and decluttered, which I kind of chuckle at because I just made one comment. Just one. But I want the front desk people to greet me. They may not know who I am, but at least friendly. If they're going to be a few minutes, just say, hey, I'm going to be a minute. The other thing is the MA, the person who comes and gets my weight and everything, I jokingly say, can I turn around so I can't look at the scales? She's fine with that. But I just want to have this positive experience when I walk in. I don't want that person to be grumpy. I don't want them to make a comment, oh, you gained 5 pounds. I just want that person to care for me in a way that makes me feel, not necessarily special, but to feel like I'm an important part of this process. That this isn't, when I look at my job, to me it's not even just a job. I actually live and breathe accounting. I'm really weird like that. But I want you to be passionate about your job. So if, like my doctor, if I have an issue, she gets passionate. Well, if the MA sees my blood pressure shot up, okay, calm down for a minute, let's take it again. But be passionate about it and just, I don't even know how to describe it. Just care for me in a way when I walk in. So if I'm sick and I walk in, I want to feel that I'm not there bothering you, but that you're there to help me. So.
Thanks. So a lot of folks in this room either have already gotten survey results, patient experience results, or they will soon. And sometimes we just had a session this morning with our Pioneer clinics, and sometimes you get the feedback and you just feel completely overwhelmed with where do I start, what do I do? So now I'm going to switch gears to your role on the Patient and Family Advisor Committee. Am I saying, is that what you call it? Yeah. Yes. And so what advice would you give folks in this room, and what have you guys done as a group, and how have you helped providers figure out what to do with their results?
Yeah, results are always overwhelming. I mean, you look at it and you go, okay, this is really bad, this is really good. Let's focus on the good, and we forget about focusing on the bad. I think as we as a committee have worked together for the past 2 years, there are things that just even come up in our meetings that we get really passionate about. One good example is the AVS, which is after visit summary. And it's very interesting. We started having this conversation, and several people on the committee had never heard of one and never had gotten one. And that spurred us into a subcommittee that created posters and that worked with the clinics to increase the usage of that, because as patients we felt that was valuable. As you're looking through your surveys, there's certain questions that came back that not where you want them to be. And so you start focusing on those, and you figure out, and I don't know how many of you guys have patient and family advisory councils, but I think it's a good thing because it allows you to have my voice or your patient's voice in how you improve that score, how you improve that, because only the patient's going to be able to tell you why that score is low. So I can't remember. I did look at the survey, but I can't remember some of the questions. But one of the things would probably be How did I feel during my visit? Was I greeted at the front desk, at the reception desk? If those satisfaction scores came down low, then that's just a matter of training your people on the front line to be more friendly, to have that more friendly persona. One good example of that is when my clinic was the first clinic to be transformed to Epic. Okay, you guys remember my mother-in-law? I love her dearly. I really do. She's my pinochle partner. I've learned how to play pinochle like she has over the years, and I love her dearly. But when I was getting phone calls from her saying, I'm on the phone 20 minutes before anybody answers the phone, and I'm on hold, I went back to the council and I said, okay, I have a personal thing here. My mother-in-law is calling me because she's on hold too long on the thing, and who is it? Was on the Scott Grudger was sitting there, and he goes, well, no, the timing is great on that. They're showing turnover times at being this, and what we found out was that they were, after 10 minutes, they were coming back on the phone saying, could you please hold still, putting them back on hold again. And as a result of that, they changed the phone message at the clinic. So it said something on the thing that we're experiencing longer wait times because we've installed this new computer system. So something as simple as that. It still wasn't the perfect solution, but it was something, so when you were on hold, you realized as a patient, it wasn't that you didn't care about me, it was that you were just, these intakes were very slow. So.
Thank you so much, Margie. Let's give Margie a hand. She's really great feedback. Very, very appreciate it.